If you could sort of snap your fingers, let's pretend for a second
Uh-huh.
you have the power to wave a magic wand, and you could give us any kind of healthcare system. You could design a healthcare system from scratch. Don't have to worry about what's there now. Don't have to worry about politics, transitions. We'll get into that in a second. And it would be as if it had been there all the time. So you don't even have to worry about taking apart the old system. And you're familiar with some of the systems abroad. I mean, and they come in all different varieties. I mean, Germany is different from Switzerland, it's different from the UK, whatever. What would our system look like? What would your ideal system look like?
It would be completely transparent,
Okay.
and you'd pay what you could afford, and the government would pay the rest. Every employer would pay some set amount that would end up being less than what they're paying today. So it might be, 10% of everybody's income. We wouldn't change Medicare. We wouldn't change Medicaid, right? We ditch the ACA. We ditch employer-based healthcare, but that employer would still pay their percentage. That would go into a pool and along with some premiums from the employee, but the premiums would be a lot lower, right? $200, $300 a month, again, means tested. And then anything you couldn't afford, because the prices are published, the government would know what to pay. And we would allow providers to opt in or opt out. If you're Mayo Clinic and you only want to deal with rich people and you want to charge a fortune and tell everybody you have the best doctors, more power to you. If you are a rural hospital, if you're, a smaller hospital or an urban hospital, whether it's Medicare rates or a reference price of Medicare rates, that's what you'll get paid by the government directly. But the hard part in all of this isn't that. The economics actually are the easy part. The hard part is there a gatekeeper? Because every other system talks about universal healthcare, and then the UK with NHS and Canada, they all have gatekeepers. You have to go to a primary care doctor first, who then refers you out to somewhere else. If we do that, then this becomes easy. Now, whether or not that's politically tenable is a different question.